Welcome to Plastic Surgery Secrets Talk, Season 3, a podcast where we go behind the scenes of everything interesting in the plastic surgery and aesthetics world. I'm Dr. Jeffrey Spiegel.
I'm Dr. Tower.
And I'm Dr. O'Neill from the Spiegel Center just outside of Boston. We are excited for Season 3 of Plastic Surgery Secrets Talk.
Yeah, wherever you're listening to this, in your car, in your headphones, in our hyperbaric oxygen tank, or just lying in bed or watching on YouTube, we're happy to have you paying attention to us and hearing our stories. Season 3 is all about stories. We've received a lot of feedback on our previous podcasts that people most want to hear interesting stories, interesting anecdotes, craziest things that have happened in medical practice in our 20 plus years and combined way more than that years of practice. So that's what we're going to be doing today, is talking about stories. And we are very excited to announce that Dr. Tower is going to be joining us in all the podcasts. So welcome, Dr. Tower. I understand you have a story to tell us.
I do have a story. I've got many stories, but we only have time for maybe one or two today. The first story is how I ended up implanting an RFID chip into somebody's arm.
What is an RFID chip?
So first of all, we're facial plastic surgeons. So what are we doing in the arm? What are we doing with computer chips? We work in Boston. So there's a lot of patients who work at Google and Microsoft, and they're tech people and biotech. And an RFID chip is one of those chips that if you have a signal that bounces off of it, it can open a door automatically. You can put your phone up to it, and it'll pull up a web page or a contact card or something like that.
All right, very cool.
So as you know, we do electrolysis at the Spiegel Center. So we have patients coming and going for all sorts of stuff. And one day I was injecting a patient for electrolysis to numb up the treatment area. And we were chatting like we always do, just to kind of make things go quickly. And they mentioned that they already had a chip, like a computer chip, implanted under their skin. And I'm going, what do you use that for? Like, I've never even heard of this before.
Kind of like a dog, no? Don't they?
Like,
yeah, just like a pet. Like our cats
so
have.
If he disappears,
Yeah.
like if he runs away, we can find him. So if a human just kind of wanders off.
Yeah, so I
probably
joked to the patient, like if in case you run away, you're found in
your
our
new owner can know your
Who
name.
knows? Yeah. So anyway, well, they explained to me that they had this chip. They use it to badge into work, actually. That's like what they were currently using it for. But it wasn't great because it was an older generation. So they were looking to upgrade their RFID chip. And they had bought a bigger chip, I guess with a better signal capability or something like that. But unlike the old one, that they could just have a tattoo artist or a piercer or something like that just inject under the skin. It had like a little thing that they just push it under the skin.
Trocar.
This one needed to be surgically implanted. So I'm going, who's going to do that for you? Like, how do you know?
And he said, or she said, you.
Yeah, right. So basically, I was like, that's interesting. I've never even heard of this before, but I just kind of volunteered to do it because, how often do I get to do something like that?
So cool.
Most of the stuff we do, rhinoplasties, facelifts, it's very routine. So I always look forward to something that I get to do that's a little new. It's just something to spice up my day.
So it's like the Terminator.
So what is this patient going to do with it?
So
where in the arm is it?
Right. So they selected a spot on their wrist, basically between a couple of tendons and a soft spot where it's not going to have any problems with flexion or whatever. We just inject a little numbing medicine, make a little opening, a little pocket for it underneath the skin, slide it in. Took like 5-10 minutes to do this. Close it up with a suture, skin glue, and immediately afterward, the patient takes their cell phone, holds it up to their wrist, and shows me their website. Just like pops up automatically on it.
It's like a magic.
So so that's basically I don't know. They go out to a
information?
Bar or they're mingling
you
or
can
whatever.
do Apple Pay like this.
So you can program it with whatever like information you want onto it. So you can change the chip once it's already been implanted.
Does it need a battery?
No, it's like a passive device. So it'll be there forever, I guess.
And she can program this to have different information anytime.
Exactly.
And what happened to the old one? Did you take it out?
No, the old one's still in there.
So now this person has two.
Well, she has two identities.
I suppose
she shows
so.
her right arm.
Yeah.
It's one
That's
person.
what I was going to say.
Yeah, I guess they can.
It could be like your professional card and your social card.
Yeah.
So I guess the lesson here for any patients out there listening we do sometimes entertain unusual requests, and just because we've never done something before doesn't mean we're not willing to listen
And where
give
does
it a
one
try.
get a chip like this?
Okay, so
Like if I want one.
so this is the amusing part. I'm glad you asked. There's a website called dangerousthings.com.
Dangerous things.
I believe that's what it's called, because I asked them the same thing. I'm like, where did usually implants, we provide the implants. We order them on,
Legal
from
disclaimer,
our
we're not associated in
No,
any way with
yeah.
dangerousthings.com.
Yeah. So
or .org.
But anyway, I guess that's like
dark web.
the major supplier for these things. And so, and they actually have like instructions for how to do it and whatnot. And the fun part was creating a consent form for this procedure that says, if somebody hacks your chip, we're not responsible for that. We're not liable if there's some sort of issue with
malfunction.
it. Yeah, exactly. So
so interesting. Now, I'm curious to go see what else is available on this website.
Yeah,
I don't know.
I don't know if anyone will be able to beat that story.
Browse at your own risk.
Yeah, I have not implanted
you ever get
any cyborg chips or anything.
Any implants that you've done that are sort of off the major, the typical chin implants, cheek implants?
I get requests.
Custom
I've had
implants.
people who want elf ears. I've had people who want
color change,
eye color change, horns.
Yeah, there's prosthetics that people will have put under their skin and stuff like that.
I've had people who want jewelry implanted into the white of their eye.
Okay.
Because you can see it, like a little silver heart or something. I have not done these.
So I do seem to remember there was a rumor, I don't even know if it's true, but a request for somebody who wanted, I don't know what was going on below the belt, but they basically wanted to enhance their sexual capabilities or sexual function or something like that with an implant that was going to go onto the pubic bone or something like that.
Yes, now there are implants for those kinds of things, and usually you would see a urologist for this, but what this person wanted was like a mount. They wanted like a little screw that would be coming partially out of the skin and partially not, onto which they could affix devices. And
so it's true.
It's true they wanted it, and it is true that I didn't perform such a procedure. But I wonder if they're available at Dangerous.
So it's not on our website.
Yeah, exactly.
So recently, and injectables are technically classified by the FDA as implants. So I don't know if this happens to you. You probably do way more injectables than I do. But I recently had a patient who was asking for lip filler. I'm looking at her lips and I'm going, it looks like you've already had filler. Like, these are nice, full lips. They've got good shape. So I'm thinking to myself, maybe you're just talking about you want to do this down the road. She goes, no, I want to have duck lips. Like, I want the lips that most people look at that and they're going like, whoa, what happened there? And who injected all that filler into their lips? Okay. So I'm wondering, do you get that question a lot for overfilled lips?
She's in the wrong city. That patient needs to go to Miami or Las Vegas or
New
York.
I've heard in the Middle East it's actually a big thing, because if people have facial coverings or body coverings, and that's all that can be seen, it's almost like a status thing. Like,
the veil sticks out.
I can afford this. I can do it. And so that's like, it's almost like having a designer bag or something like that.
That's so interesting.
Yeah.
I think because I tend to be more conservative and less vaboom, I think that people that come to see me are more comfortable with like natural.
Very natural look. Yeah.
That's the way I usually,
And we are in New England and, right outside of Boston. So I think people that come to see me tend to want like more conservative, more natural, just like a little flip, just a little tweak, which sometimes is a lot harder than making a big, full, blown out lip.
Oh, overdoing it's easy. You just keep going.
Yeah.
It's unusual for someone to want to look done. But do you get that? Like with surgery, people who say like, I don't want to look natural. I want to look like I've had surgery and that,
I do. We do get people who come in and say, I want these cheeks to look like a real standout, ridiculous thing, like a cartoon character.
Yeah.
And in general, I tell them, I'm interested in making you look good.
Yeah.
And there is a little bit of subjectiveness to what's good and what's
so
not good.
How do you handle that when you do you accommodate the request?
I'm not your person. If you want to look like a cartoon character, everyone who leaves our office for the most part leaves with our like our name on it, right?
Yeah.
You mentioned designer handbag. It's got the brand name on it, and you want to know that what you're putting out there is good. Or I guess in this case, it's like, everyone who exits our office has like the chip in their arm of our name.
Mm-hmm.
And
well, I'm actually tracking that patient, so I know exactly where they are based on their chip.
What they're saying. Okay, so excellent. We've talked about unusual things that have gone into people, and come back in September where we will talk about unusual things that have come out of people. And we're going to end today with 2 truths and a lie. So Dr. Tower is going to tell us 2 things that are true and 1 thing that is false, and we have to guess which one is the false one.
Yes. And
okay.
These all have a theme. Reasons why we had to cancel surgery at the last minute.
Okay.
And it doesn't happen often, but these are a few recent ones that kind of come to memory. So, number 1, I had to cancel rhinoplasty surgery at the last minute because of a patient snorting cocaine.
Okay.
I had to cancel facelift surgery at the last minute because of a patient injecting Ozempic.
Okay.
And I had to cancel eyelid surgery at the last minute because the patient had an unknown pregnancy. Dr. Rainier, do you want to guess
True,
first?
false, true.
True, false.
So you're saying the Ozempic is false?
I think the Ozempic is false.
I think all 3 are true, which is not the way this game's played, but all 3 of those things are absolutely possible.
Okay, so the rhinoplasty one is true. I did have to
People at
cancel.
home don't use cocaine, and especially not within 6 months of your surgery.
And when can I do cocaine again, doctor? Never. You never do cocaine again.
Right.
And the facelift one is true. So GLP-1 and agonists, basically the Ozempic, Wegovy's, there's a whole bunch of Zepbound, there's a whole bunch of these medications now. If you're taking them, you have to stop taking them, I say about 2 weeks before surgery. Some people say 1 week. I think 2 weeks is...
Is that because we want your weight up for surgery?
It's because it slows down the transit through your stomach. Yeah, so your stomach's not empty. The anesthesiologist can't induce anesthesia if you've got anything in your stomach. So
That's
same
right.
reason why you can't eat before surgery.
So it's much safer to not be on Ozempic for a week or 2 before surgery.
And I'm sure the unknown pregnancy thing has happened at some point in my career, but I don't believe because of eyelid surgery. So that was the false one. Probably the most common reason to cancel, or among the more common reasons, but I don't think it's ever happened to me for eyelids.
Now, I have had that happen to me where we were doing surgery and someone's pregnancy test came back positive. And in one situation, which I'm remembering, the woman said to me, "Yeah, whatever, I want this surgery." Like, no, that's not how we do it here. I'm sorry. We're going to have to wait on this one. Okay.
It was the right call.
Excellent. Interesting stuff. Thank you for listening to Plastic Surgery Secrets Talk. If you like what you've heard and want to get in contact with us, call 617-566-3223, which is 617-566-FACE on an old-fashioned telephone, or email us at info@drspiegel.com, I before E. And you can also follow us on all your favorite social media channels, and all the ones you hate probably too, at drspiegel.com. See you in September.